and I'm just setting up my PowerPoint for folks. So that should be there in a short moment. And now we'll get it to show you the slides. Let's see. I'm getting close. Okay. Here we go. Thank you, everyone. Very glad to be with you all today. Our topic is, of course, tightening the safety net. And, the emphasis will be on the challenges, but I also want to remind everyone that there are opportunities. And in my way of thinking, we really need to stay focused on how we get through all this and what we can do to try and make it better, even in the short term. So I'm going to start with, if this screen will move forward, it usually takes a while before the clicking works. Come on. There we go. I'm going to start with the overall context because, of course, as the materials emphasize, this is going to be about the impacts in LA County of recent developments with both the federal and the state budget. And I'm going to start with the state budget because that's California's reaction to all of these federal cuts and changes. So last year in our state budget, there was a $12 billion overall shortfall. So California made some really big cuts, which we'll talk about in a moment, to healthcare programs to help close that gap. Now, this year, our governor thinks things look a little better, considerably better. The gap for the coming fiscal year will be 2.9 billion. However, the state's legislative analyst says, no, I think it's going to be much higher, around 18 billion. So my point is things could really change and fluctuate. And both the governor and the LAO point out that the numbers could go up because costs are just rising generally. If the AI bubble bursts on the stock market, that will affect state tax revenues. The feds are investigating so-called fraud in Medi-Cal's IHSS and other community-based services. And they're also trying, as you well know, to claw back even more money from public health and research funding. So we just have to be aware that it's a challenging fiscal environment. And that's the reason the governor gives for the cuts he's proposing in the upcoming budget, leaving the cuts from last year in place in our budget and even cutting more. Why is this? Well, as indicated, the Republicans and Trump have taken massive amounts of federal dollars out of health, nutrition, and other human services programs. And they've done this basically by cutting eligibility and benefits and making it harder for states to raise non-federal revenue to draw down federal match. As an example, the feds in this latest budget agreement from July of 2025, which the president signed, no Democrats signed on to it, so it really is a Republican initiative. The legislation is referred to as HR 1, and I'll use that terminology for simplicity throughout, but it's basically Trump's budget. He cut $1 trillion from Medicaid and in our state covered California, the exchange, and not only took that money out of these healthcare programs, but redirected it to Homeland Security for ICE and BCP. And you all, especially in Los Angeles, are living with the consequences of ramped up immigration enforcement, detention, deportation, and the rampant illegal contact of these federal enforcement agents. In addition, those funds were used to reduce the tax obligations of billionaires, not millionaires, billionaires, and profitable large corporations like Amazon's, your Googles. So if you look at 1 trillion and you look at what went to Homeland Security and these tax cuts for the ultra wealthy, it kind of that shows you where the 1 trillion is. And as I mentioned, they also made it harder. They changed some of the rules. So they made it harder for states to raise the revenue that they need to pull down federal matching funds, right? Because, for example, Medi-Cal, states typically put up half the cost, the feds pay the other half. But to raise that money, um, the feds changed some of the rules for doing that, and they also decreased this special match of 90% for certain emergency Medi-Cal services to 50%. So that's like a 40% hit. California, from that change alone, will lose 658 million. And from the managed care organization tax changes, we stand to lose 1.1 billion. So this is not to scare you, but it's to explain that the issues, about revenue are going to be complicated for our state this year. Now, all that said, remember, this is just the governor's proposal that we're going to look at in a little more detail in a moment, right? It's not the final budget. The legislature can insist on doing things differently. Let's remember that California is the fourth largest economy in the world. That's not amongst the 50 states, that's in the world. So clearly, the wealth exists in this state to significantly offset these federal funding cuts, right? We just have to do a better job with policymakers of getting them to prioritize support for the safety net. Now, yes, that will require finding ways to come up with state funding, more state funding. And there are a lot of people working on this. So you've probably heard that there's a major ballot initiative that people are collecting signatures for to use a one-time tax on the wealth of billionaires and use that money to support our healthcare system. Others are proposing a different approach to generating the revenue. One of those examples is closing these large business tax loopholes to generate ongoing revenue. And there may be other ideas to come, but keep in mind that we have to look for real revenue solutions. Okay, so in sum, let's start with Medi-Cal because I know that's such an important part of your work. The changes we're going to focus on come from these federal budget cuts under H.R. 1, the new Medicaid restrictions, Medi-Cal in our state, of course, and the related federal budget cuts, and also from decisions that California made last year for our state budget. Now, before we get into all the bad stuff, let's take a deep breath and focus on what's still available, even under the governor's budget, right? So, children up to age 18 are still eligible for full Medi-Cal regardless of their immigration status. And I know, obviously, that's a very important part of your work. So, the kids are all still covered for full scope Medi-Cal. And the minor consent or sensitive services program is still there. Now, during pregnancy, as well as the 12-month post-pregnancy period, the adults also remain eligible for either full scope or what the state sometimes refers to as full breadth Medi-Cal. It's not a term that I would use, but basically full breadth is supposed to be the same as full scope, okay? So that's not changing. The immigrants of all different types of categories still qualify during pregnancy and 12 months post. In addition, very low income parents or caretaker relatives, and by very low income, we mean 100% of poverty or below. And I think many of your clients fit into this group. They're still eligible, but here, unfortunately, because of the changes, um, they won't be eligible for full scope anymore unless they're citizens or federally qualified or enrolled before December 31st of last year. And we'll talk a little bit more about that. But keep in mind that very low income parents are still going to be covered. And then there are the seniors, 65 and older, and other people who qualify for Medi-Cal based on disability. And you may have some of those clients too, right? With abuelas, abuelos, the extended village of adults that help families care for young children, or even some young children themselves in families with income over the Medi-Cal limit, but who are disabled and have their Medi-Cal based on disability. Status will matter for those groups. And unfortunately, they will have a very high share of cost unless they're extremely low income. So we can get into some more of these details, but let's just remember that a large part of the Medi-Cal program remains intact for children and adults during pregnancy and other very low income family members and caregivers. Now, the one big change for these groups is, unfortunately, under HR 1, starting next year, their retroactive Medi-Cal will be available for only 2 months instead of 3 months, right? So that's retroactive when you apply, say you apply in June and you had your baby uninsured 3 months ago. Under the current rules, you could go back 3 months to capture that with Medi-Cal funding. Under the rules that will go into effect starting January 1, 2027, you've got to apply for Medi-Cal more quickly to be within the 2 month retro period. Okay. Some other areas that I know are important to your work, people will also continue to qualify for Medi-Cal for the following types of programs and services regardless of their immigration status. So that's the FAMPAC program for family planning and the related primary care services, the breast and cervical cancer screening and treatment program that will be limited again to the breast and cervical cancer. It won't be full scope Medi-Cal, but it will be available for breast and cervical cancer screening and treatment. And of course, emergency care will be available regardless of status. Kidney, renal dialysis, and long-term care services, regardless of status. Again, these are for, very low-income people, but the services are still there. And then there's a category, I'm not sure how familiar folks are with it, but I did want to flag it for you because it's a very important way to get immigrants into full scope coverage when there's a very significant medical need. And this is the PRU-Call category. It stands for permanently residing under color of law. And the person has to be someone who the U.S. Immigration authorities know is present in the country, and the person isn't under threat of deportation. So it's a little complicated. My colleagues at MCH Access, for example, know a lot about this. So if it's something you need to know more about or have questions about in the context of individual patients, we can get you to the right place. But we did want to flag that. It can be very, very helpful, for example, for severely disabled children who don't have status and may have income over the Medi-Cal limit. Okay, so now let's shift to the less positive news. Starting in October of this year, 2026, under these new federal laws, HR 1, certain lawfully present immigrants are going to lose federal matching funds under our Medi-Cal program for their non-emergency services. So it's not that they're not eligible, the states can still cover them, but the feds won't pay their part for these groups. Now, that means a lot of money is being taken out of California's budget, or will be starting October 1. The governor's proposal doesn't backfill for that, and it really should. And a lot of advocates in Sacramento are working on that. The governor's approach is just to say, well, we're losing the federal match for these folks. We're going to cut them back to restricted Medi-Cal. So who does this affect? It's about 200,000 immigrants, refugees, asylum, people granted asylum, people granted permission to be in the United States because of their battering or having been trafficked, Afghans and Iraqis who helped the US military, and certain other categories, right? Until October 1, they're all eligible for full scope with federal funding. But after October 1, we lose the federal funding and the governor wants to cut them back. We'll need a certain amount of revenue to fill that gap. I'm giving you the number there. Don't let it scare you too much. But that's what advocates are working on, filling that hole. Until October 1st, nothing changes. But, keep in mind that this could be on the horizon. And I just want to remind folks that the children and the pregnant or 12-month post-pregnancy adults, even if they're in these immigration categories, they're not subject to the reduction. They'll still have access to their full Medi-Cal, and so will people who have that lawful permanent residence card, the green card, also the Cuban Haitian entrants, and people from Micronesia, the Marshall Islands, and Palau.
Lucy, we did have one question come through the Q&A.
Yeah,
Someone asked about NMDs from 18 to 21. I'm not
18
quite
to
sure.
21, NMDs. My brain is freezing. What's the NMD?
I'm not too sure. If you were the person that submitted this question, if you could help clarify for us. Not too sure what NMD is.
I
Oh,
apologize. I'm not. Go ahead.
thank you, Lori. Lori answered her question. She says non-minor dependents still in foster care. Thanks, Lori.
Non, okay, non-minor dependents still in foster care. Um, Great question. If they're legal immigrants, I think they are affected by this, but don't quote me. Um, if they are without any kind of status and they are over 18, I'm not sure what position the governor's budget takes. So that's a great question, and please let me get back to you.
Thank you.
Okay, yes. This is part of the bad news, but do remember that the kids, the pregnant people, and we're going to answer this question about the NMDs and the foster care issue, and this other group of lawfully present immigrants do continue to access full scope in California. So then let's look at what's happening with some of the adults. Now, these changes under HR1 affect all of the adults, not just the immigrants. And I think you can see the obvious federal design here, right? It's, well, okay, for little kids and pregnant people and some of the old people and some of the people with disabilities, we'll let them have access to healthcare. But by gosh, if you're an able-bodied adult in this country, you shouldn't be depending on these public programs, right? That's kind of the mindset as you look at these changes, right? Without taking into account how unaffordable health insurance is for working people, especially people working at very low wages, right? And one of the things that Obamacare did, also known as the Affordable Care Act, right? It expanded Medicaid eligibility, Medi-Cal in our state, to adults who weren't pregnant, to people who weren't little children, to people who weren't new parents, right? It just said you're a human being, you can't afford health insurance, the market isn't there for you, there will be federal support. So that's this group of adults ages 19 to 64, men and women, citizens, legally present, etc., right? They're the people with the main target on their back in HR 1. Now, the changes we're going to, and they're also very low income. Let's not forget that, right? If they have income over 138% of poverty, they can't qualify at all for no cost Medi-Cal. So these changes under federal law, we're going to have to deal with them in California because they are federal changes, right? They start January 1, 2027. One of the changes is that for these adults, let's call them expansion adults, right? President Obama expanded Medicaid for these adults, 19 to 64, regardless of whether they have children in the home and regardless of pregnancy. These expansion adults will have their eligibility for retroactive Medi-Cal. Today it's 3 months. Till the end of this year, the retros will be available to 3 months, but starting January 1, it gets reduced to 1 month. So again, we have to act quickly to help these patients if they're applying for retros. And again, I just wanted to, put in the reminder for the children, the pregnant people, adults 65 or older, and people with disability-based eligibility. It's going to be 2 months of retros. Still bad because cut from 3, but better at least than 1. Now, this change saves our state 23 million, right? Because we won't be able to get federal funding for anything more than 1 month. And then another big change is, again, limited to these adults um, in this age group, 19 to 64, is that they'll have their eligibility reviewed twice as often. So until the end of this year, the reviews have been once every year. But starting in January of 2027, it'll be every 6 months. Now, why is this a concern? Well, we all know what happened during COVID when people were kept on, and then we had to review their cases after a certain amount of time. And we lost so many people because of what are called procedural reasons, meaning they just couldn't deal with the paperwork. And so we know we have a track record here in California. The state is estimating that based on the COVID experience, we're going to lose around 400,000 people when this gets implemented from the Medi-Cal rolls, not because they're not eligible, but because of the red tape. So that's another concern. And we're just going to have to do our best to help these adults in these categories who are having to review their cases more frequently get through it. Now, another big change under HR 1 are the work reporting requirements. The federal law refers to them as community engagement requirements. These also start January 1 of next year. I want to begin by emphasizing the exceptions, right? Because this is so important for your client population. They do not apply, the work reporting community engagement requirements do not apply during pregnancy or the 12-month post period. They also do not apply to these very low income parents or caretaker relatives. So it becomes important to kind of know where on the income spectrum people are. Or if the family has a full-time student, um, the kid can be as old as 21, and the parent or the caretaker relative will be exempt from having to report about work activities. Also, a caretaker, a low-income caretaker with income up to 138% of poverty, of a disabled person of any age, or the caretaker of a child 13 or younger, will also be exempt. These I think are a big part of your core populations, right? And then people with disabilities, mental or physical disabilities, or what the federal law refers to as medically frail. We're waiting on better definitions of what that is, but it clearly will include substance abuse disorder. Those people will be exempt if they're identified as being in those categories. Students will be exempt, people in job training programs, people who volunteer can also be exempt. Now, again, we're waiting for more details on what kind of job training, what kind of volunteering. I think I know the credit hours for students. I apologize for not having it put it in the PowerPoint, but I can get that for you. And there are other exclusions and exemptions. So if the families, you're dealing with don't fit into any of the like really obvious categories, caretaker of a child under 13, for example, or 12 months post pregnancy, right? You do really want to consider some of these other exemptions from work reporting. If the person is subject, and again, these are the adults 19 to 64, right? That's who this applies to. If the adult is subject to this community engagement requirement, then they're going to have to prove that they've worked 80 hours a month, a certain time period. And, we can go into more of those details as we get closer to January. We're all going to want to, get up to speed about, what counts as an hour and in what period and all of that. And we'll be ready of that for you. But it's very troubling because the state estimates that it will lose, around $374 million. Again, not because the people aren't eligible, but because of the red tape. And this conclusion is based on the fact that there have been several other states in prior years who got federal permission to impose these more harsh work requirements in their states. And that was the result in states like Georgia and a few others, right? Lots of people, unfortunately, were discontinued, but they were eligible. They just didn't keep up with the work reporting red tape. Uh, Again, to emphasize the human costs, our state estimates that by June of 2027, up to 233,000 adults will lose their Medi-Cal because of the work reporting requirements. By January of 2028, that will rise to a million. By June of 2028, 1.4. So it's a significant issue for all of us. Okay, if there are no questions, I'll continue with the next set of changes that we need to be really aware of. So we all remember that California, over the last couple of years, did an amazing thing for human rights, I believe, as well as healthcare rights, right? Our state expanded no cost Medi-Cal, no share of cost Medi-Cal to the very low income adults, regardless of immigration status, right? We started first with people over 65, and then we added the kids. We're keeping the kids, right? But the last expansion was for these expansion adults, right? 19 to 64. The feds didn't cover them for non-emergency services, but California stepped up and said yes. And that's been tremendous, I think, for example, for interconception care, right? And so many other things, family finances, the stability of the village that supports families with young children. California did a great thing. Unfortunately, excuse me, the governor and the legislature last year decided that because of the federal changing environment and the status of the state budget, that program had to go away. And so I think you're probably aware that starting January 1 of this year, 2026, California closed our state program to new applicants who don't have legal status. Now, remember, the non-emergency coverage has always been funded with state dollars, but California shut that down because of what was seen as a budget necessity. So as of January 1, the new applicants who are 19 or older can only get restricted Medi-Cal. And this again saves because the state doesn't have to spend. You can see the dollar amounts there. They're kind of scary. I'm not going to say them out loud, right? Because we have to find a way to backfill that, is the point I'm trying to get to. So until we can get our full scope program back for all of the adults, regardless of status, it's important to remember that during pregnancy, the applicants will be put into what this weird kind of scope definition, but it's supposed to be the same as full scope. And that's during pregnancy and 12 months post. So that's all the medical services, all the specialty services. It's the dental, it's the mental health. It's the full breadth is supposed to be all of it, right? So even though we have this, restricted program now, if people apply when they're pregnant, they'll go into this full breadth category. But what happens if you've applied after January 1 of this year and you were enrolled in restricted because you weren't pregnant at the time you applied and you become pregnant later? Technically, you should still be able to get full Medi-Cal, right? So if that's working for a client, great. If it ain't broke, don't fix it. But we are finding that letting the county know, and you are supposed to let the county know if there's been a significant change in circumstance, and pregnancy is one of those changes. Letting the county know should result in the person being moved to a category where it's easier to identify the full benefits. It won't be called restricted anymore, and providers won't be confused, right? And also, they'll get automatically linked to the 12 months post-pregnancy eligibility, and they'll also be identified as eligible for 2 months of retros instead of just the 1 month that the other adults are going to be limited to. So I know that's a lot to absorb. You'll have the slides from the PowerPoint, and MCH Access are experts in this stuff. But just kind of a heads up that it might get a little tricky figuring out the best places for the pregnant adults to land. And again, as I've emphasized, people are working in the legislature to try and get this full scope program, regardless of immigration status, restored in California. Okay. What about those undocumented adults, 19 or over, however, who did enroll before 2026? So there's some good news here. If you're found eligible on or before December 31st of last year, then you keep your full scope coverage so long as you continue to meet those eligibility requirements. And, the main requirement is you have income at or below 138% of poverty. That's the cutoff of income for the adults in this category, right? And if for some reason you get discontinued, you have a 90-day expansion grace period to correct that with the county. Like maybe you were overwhelmed with all the paperwork requirements and you didn't explain to the county that no, their database is wrong on what your income is now. Maybe it was that last year, but you have less income now in this month that you're being discontinued from Medi-Cal. You have 90 days to correct that and keep your full scope under this category. However, starting July 2026 of this year, the non-emergency dental benefit will be removed from these folks. They'll have full scope except for non-emergency dental. The good news is if they're pregnant, they are entitled to keep full dental along with the rest of their full scope. And that's not just during the pregnancy, but also within the 12 months post. And same with premiums. This category of folks who are coming over from 2025, undocumented adults with full scope Medi-Cal, they'll have to start paying premiums in January of 2027, $30 a month. Again, the exception for pregnancy and 12 months post. So this is another example. We don't know quite how it's going to work in the implementation. Like, will the pregnant adults really be identified for these exceptions? So this is another example where letting the county know about the pregnancy to get switched over to one of the pregnancy programs might be to the person's benefit. If this works seamlessly, it really is the best option because then you continue as long as your income is at or below 138% of poverty, even after the 12-month post-pregnancy period. I feel like I'm getting way too technical and way too wonky, so I'll stop there. You'll have the slides. Happy to take questions and know that MCH Access can help on a case-by-case basis.
Thank
Any
you so much,
question?
Lucy. I did have one, yes, there was one question that came in through the chat
Huh?
regarding the $30 premium. Jessica is asking, is the $30 premium per Medi-Cal case or per Medi-Cal beneficiary?
Great question. I think it's per person. But let me ask, right? So if you have two adults in the household and they're keeping their Medi-Cal from 2025 full scope, does that household have to pay $30 or $60? The way premiums usually work, it is per person with the insurance, but let me ask to be sure, and I'll get back to you. Thanks. And oh, go ahead.
Oh, no, just thank you. And if there's any other questions, go ahead and drop them in the chat or in the Q&A box. Thanks, everyone.
Thanks, Laurel. And then just one final point on this group. Remember, because of HR1, there are all these changes for the adults 19 to 64, even if they're citizens, right? So the governor's proposing to just mirror the restrictions, to just adopt all the bad federal stuff that's being imposed on the citizen adults and carry that over into this special state program. Remember, we use 100% of California's dollars to cover the non-emergency part of their care, right? So California is not obligated to impose the federal restrictions on this state-only program, right? We could choose to not make this group of adults have to have their eligibility reviewed every 6 months instead of every 12 months. We don't have to subject them to the work reporting requirements. And in fact, that's particularly troublesome for these adults. Why? Because many of them are not authorized to work. They may be working, they have income, but they're not authorized to work. So that presents a huge barrier, a huge deterrent. People are working with the legislature to try and convince the legislature to reject this part of the governor's proposal. So stay tuned. Okay, I want to shift to some more better news, though. The governor is proposing to increase grant funding to reproductive health care providers, mainly the Planned Parenthood clinics and other family planning service providers, by $60 million. It's not a whole lot of money in the big scheme of things, given how deeply the federal government under HR1 has already cut family planning services in our state and others. But it is a really good sign that there's, a willingness to try and address this. And I believe, if I'm not mistaken, don't quote me, but I believe there's a separate bill in the legislature with additional funding that may have already passed. So that's the good news. It looks like, this particular problem is getting some attention. But then again, we've got some challenges. This next issue isn't really about the state budget, but I especially wanted to flag it for you all. It's a state bill that was introduced relatively recently. It's SB 912. It mainly addresses Medi-Cal's comprehensive perinatal services program benefit. So that's definitely in your wheelhouse with pregnancy-related care and the 12-month postpartum situation. But it also moves responsibility for the Nurse Family Partnership Program out of the State Department of Healthcare Services over to the State Department of Public Health. That's the proposal in this bill as introduced. Now, I honestly don't know yet what the motivation was for making this proposal. The bill hasn't been heard yet, so we need to do a little more research to find out what's going on here. If any of you happen to know what the intent is, what the result would be, what the impacts are, please feel free to educate me. But I did want to flag SB 9112 for you all specifically for that reason. Excuse me. Okay. So take a deep breath. We're going to move out of the Medi-Cal space and on to other issues. And unless I see Laurel giving me the signal, I'm going to assume there are no other questions.
You did have one. Marlene
Okay,
asked a really great question in the Q&A related to Medi-Cal. So she's asked, what supports are available for families to help them meet the requirements for redetermination? Are there numbers or places they can go for assistance?
that's such a great question because, as we all know, there's no substitute for a human being who knows what they're doing to help people get through these kinds of red tape challenges. The bad news in recent years has been that funding for navigator services, healthcare, community healthcare navigator services, excuse me, has been significantly reduced. You all in Los Angeles have that fabulous network made up of approximately 19 organizations called the Community Health Outreach Initiative, CHOI, that has a robust database and does trainings and really provides a lot of support to the community, not only about enrollment, but also with these redeterminations and accessing care. That funding has really dried up in recent years. We are cautiously optimistic that there are some major developments locally in LA County going in the right direction. I don't think I really can say much more about that at this point, but I think we'll know soon whether for LA County, much of choice capacity, including at MCH Access, will be restored. If that happens, I think there will be a major effort to, alert you all about who participates in CHOI, what their phone numbers are, how to reach them for help. In addition, the state seems at least open to the idea, and the counties are really pressing this, that the county Medi-Cal departments need more resources and support to help, they call them customers, right? People, to help people who are trying to reach the county for help and to have enough staff in the county offices to actually provide that help. So we'll see where that goes in the state budget. You all, I'm sure, are aware that if you use the local call center number to get through to LA County for help with something like your renewal of your benefits, you could be waiting on the phone for hours only to be, cut off without getting through to anyone. So there's an effort also to at least do a better job monitoring what that situation is. And I hope that will lead to more resource with the call center situation. There are the online options. I won't spend a lot of time with that, but they're really not a solution for people who haven't been able to do this on their own anyway, right? There really is no substitute in many cases. I mean, some of the, Medi-Cal beneficiaries are fine taking care of stuff online, and more power to them, but that's not a good fit for everyone. And I'm sure that for many of your clients, they will need that individual support. So, on this, I would say stay tuned. If you light candles or cross your fingers about the local resources for CHOI in LA, now would be a good time to do that. Okay. Any other questions, Laurel?
So far that is all. But guys, please again feel free to put your questions in the chat or in the Q&A. Thank you.
Yeah. Okay, so now we're going to shift gears to CalFresh. And this is a no-brainer for your communities, right? I mean, how can we possibly hope to assist people with their healthcare issues, especially, during pregnancy, after pregnancy? How can we even hope to support child's well-being if people don't have adequate access to appropriate nutrition, right? And so the CalFresh program is a critical part of healthcare generally and of your work. And I'm sure you're all aware that CalFresh is part of what the federal government refers to as SNAP, right? Back in the day, it used to be called food stamps, but I do find that there can still be some confusion with all these acronyms, right? It's all the same thing. CalFresh is SNAP is food stamps. And the research shows that it has been, this program has been consistently linked to improve outcomes and lower healthcare costs, right? So we really, really want to do everything possible to make sure people get access to these benefits. Now, before HR 1, the benefits were funded 100% by the federal government, and that has meant around $13 billion to California in recent years. And the feds also have been paying 50% of the program costs. And then that balance, that other 50% in California, is paid in part by the state and in part by the counties. Well, a lot of this is going to change under HR 1, unfortunately. The first big change is that starting April 1st, so that's, not that far away, certain lawfully present immigrants will no longer be eligible for CalFresh. And these are the same groups that will be losing their federal match for Medi-Cal in October. There are a couple of groups that can qualify for this California Food Assistance Program, which is a state program, but not all of the people who are lawfully present immigrants who are losing their federal eligibility on April 1st will qualify for CFAP. Okay. So this is a big concern. The state estimates about 72,000 lawfully present immigrants will lose their benefits, either if they're new applicants after April 1st, or if they're already enrolled before April 1st, then at the next time they recertify. And unfortunately, the governor's proposed budget does not fill this gap, but it should. And advocates in Sacramento and, throughout the state are making the case about why it should. Now, I have a really great one-page flyer from the Food Bank Association in Sacramento County. It's just hot off the press that summarizes this change for April 1st. And Laurel, if you remind me later, I'll be happy to put it in the chat so that everyone will have it today. And it lays out the specific categories and this exception. And it also gives some, phone numbers to call, at least for that region. And I'm sure if people need to adapt something like that, we can work with Sacramento to get their permission. Okay, so moving along on the bad news front, I'm sure those of you who work with CalFresh are familiar with this term, able-bodied adults without dependents. And I'll just stop here a moment to, connect us back to the Medi-Cal conversation about the adults 19 to 64, right? HR 1 really took aim at these so-called well, it took aim at, adults who Trump and the Republicans think shouldn't be receiving federal help. Let's just put it that way. And these are individuals who don't have children or other dependents that rely on them. Now, under the rules before HR 1, the ages for this adult group were 18 to 59. And they already had to register for work in California to get CalFresh. So under HR 1, even more of the adults get included in this category for further restrictions. And we're going to talk about that next. But these are the categories to which the able-bodied adult designation is expanding. So instead of capping out at 59, it's going to go up to 64. 19 to 64 will be the able-bodied adults without dependents category. The caregivers of kids, they'll only be they'll be in this category if the child is 14 or older. Before, you were out of it until the child turned 18. Former foster youth are now going to be included under federal law as able-bodied adults if their age is 18 and up. More of the veterans will be included in this category, and homeless people will be included in this category. So these are significant changes. Yeah, yeah, they're significant changes. Um, Now, why does it matter to be tagged with being an able-bodied adult without dependents? Why does this matter? Well, starting in June of 2026, so again, that's not that far off, right? These new time limits will be implemented in California for this expanded adult group. They'll have to prove 20 hours of work a week or 80 hours of work a month. The activities will be similar to the ones that the adults under Medi-Cal will have to show for their work reporting or community engagement. So there's a fair amount of overlap. It's not identical, but there's a fair amount of overlap. And I do know that our state, healthcare services and CDSS, they're working to do as much of the overlap as the feds will permit so that if you prove you're meeting the requirement in CalFresh, you'll basically automatically get counted for meeting it in Medi-Cal and vice versa, right? That's what they're setting up to the fullest extent that federal law will allow it. So that's good news, but I wanted to flag that about 92% of the CalFresh enrollees receive Medi-Cal. So if you're helping a Medi-Cal client with their work reporting, you're also helping them with their CalFresh, right? Because most people in Medi-Cal are also enrolled in CalFresh. It doesn't work as well in the other direction because only 34% of Medi-Cal enrollees receive CalFresh, but still there's that overlap, right? So just keep in mind that there may be some exceptions, right? Because it's not a perfect overlap, so we have to be careful and work with, folks who really know this stuff. If your clients aren't getting the automatic credit, let's say, for meeting the work requirements, but this is a very good start. If these able-bodied adults can't prove that they've met the work exception, then they'll be eligible for CalFresh only for a maximum of 3 months in a 3-year period. So this is a very significant change, right? If you don't meet the requirement, you're basically going to be time limited out of it after your 3 months, and that exclusion will last for 3 years. Now, I'm going to talk about the exceptions in a minute, but I wanted to, make sure we're understanding how different this will be, especially for the former foster youth, the veterans, the homeless people, and an expanded group of caregivers, et cetera, right? Now, the state estimates that about 840,000 people will be subject to this in CalFresh, to the new requirements. And of those, and I'm not trying to alarm people, I'm just presenting the state's estimates. And I think it's important for the legislature to be informed about how bad this could get because we need them to find the revenue solutions, right? This is not just tinkering at the edges, right? This is like a very big deal. The state estimates that up to 610,000 people could lose their benefits, their CalFresh, not because they're not working, not because they're not eligible, but they just can't keep up with the paperwork. And of those, about a third will be homeless. And these numbers come from, the Senate subcommittee through the Department of Social Services. So it's a very big change. It is driven by the federal rules. So it does mean that California has to invest the resources to help people meet the paperwork requirements, right? It's not so much a question of eligibility because the data show that most of the adults in these categories are working, or if they aren't working, it's because of a disability or because they have childcare responsibilities, etc. Now, I want to leave us on a more upbeat note, right? There are big exceptions, okay? So, for example, maybe this doesn't affect you in LA directly, but in Colusa, Tulare, and Imperial counties, they'll at least be exempt from these work requirements until the end of October of this year. And that's because the unemployment rates are through the roof in those counties, right? And then the CalFresh exemptions that we have today also remain in place for the following groups. So people under 18, so kids under 18, anyone who's pregnant. I'm not sure this exception applies to the 12-month post-pregnancy part. But if you get the exemption for Medi-Cal that way, maybe it'll apply here. Stay tuned. We're trying to figure that out. Anyone who's certified as physically or mentally unfit to work. I'm not as familiar with CalFresh. I don't know exactly how that works in CalFresh, but that existing exemption stays in place. And there's a group of people in the refugee category who will also meet this. So it's important to keep in mind that these existing exemptions remain. Many of these are very important for your work, right? And then some new exemptions have been added. And here I want to highlight the urban Indian exemption, and there are other California Indian exemption groups that have been added. So it's a lot to take in. June 1st is coming up, but hopefully we can all work together to be prepared. Hopefully the legislature will figure out some ways to provide more community resources to help people access eligibility, retain eligibility, and more state-only funding for those who fall through the cracks.
Lucy,
Okay.
did have
Yes.
one question come through. You touched on this very briefly, but I just want to make sure that we ask
Yeah,
it.
yeah.
Um, does an able body, or does it explain how it defines mental health and substance use disorder status? Is that taken into consideration?
I think that's a really important question. And since I don't do a lot of direct service work with CalFresh, it's been, let me just say, a while since I've been in the field on this particular program. I really don't want to answer, but we can certainly get back to you. Absolutely on the Medi-Cal side. Absolutely on the Medi-Cal side, substance use disorder, mental health, all of those diagnoses should count for the Medi-Cal work reporting requirement exemptions. And so, as I said, to the extent that you're getting people exempt under Medi-Cal, hopefully it'll work in CalFresh. But let me, Laurel maybe can help me, remember. I'm going to make a note here too, but that's a specific technical question that we want to be sure to answer. I think the answer is yes, but let's triple check. Okay. Anything else, Laurel?
Nope, you
Okay.
answered the other question that was in
Okay.
the chat, so we're all good. Thank you.
Yeah, yeah. So then moving forward, there are some other important changes with CalFresh to be aware of because this too will impact how many financial resources we have available in California for the program. I mentioned earlier that the feds have been covering 50% of the admin cost, right? They're shifting that or they're reducing it to 25%, which means the state will have to pick up 25% more of the administrative costs. So that's a concern. And this is the part of CalFresh that impacts the CalFresh outreach program. So, at a time when the rules are getting much tougher, at a time when people will need much more assistance with outreach and helping retain benefits, um, there are going to be fewer federal resources to support application assistance and retention assistance for these networks of community-based organizations across the state. In addition, the payment error rate for states is going to uh, could subject us to greater penalties. So, under the new rule, if a state makes 6% or more mistakes in determining CalFresh eligibility or retention, if that rate is 6% or more, then they can lose a lot more money. In other words, the penalties, the amount of the penalties, and there are all these formulas, right? But the point is the penalties have been increased under HR 1 for the CalFresh payment error rate. Now, the national average for this SNAP payment error rate is just under 11%. Um, the national average rate is around 11%. And California, for the most recent fiscal year that I had information for, was around the national average of 11%. But if we continue to remain above 10%, then under HR 1, we'll have increased penalties and we start losing 2 billion in 2027, 2028 fiscal year. So the governor's budget does propose more resources for the California Department of Social Services to attempt to get that error rate down so that we're less at risk of being subjected to the higher penalties. But this is, a complicated issue, right? Because the rules are now more complicated in the field, right? So it's going to be harder to work with people on their eligibility and retention for CalFresh, and what impact will that have on the error rate? And would there be the resources both administratively and the community to get the right people connected to the benefits? Okay, so. I do want to underscore that, people are mobilizing in Sacramento to impress upon the legislature and the governor about how difficult this is in the real world. And we'll just have to see what progress we make in finding other state revenues to deal with some of these issues. There's an excellent chart at this link from the Senate Budget Subcommittee that reviews both Medi-Cal and CalFresh. And what it does is it compares the work reporting requirements. I'm not reproducing the chart for you guys in the PowerPoint because it's pretty wonky, but some of you might want to see that. In a weird way, I find it kind of reassuring because you can see the areas of overlap. And so if we have teams working on the Medi-Cal side and teams working on the CalFresh side, and the policy advocates are already working with the two state departments to get them to overlap as much as the feds will allow them, it's like weirdly in a wonky way reassuring. So I present that to you. And it also, if you want to dig into the weeds, I'm not encouraging you to have to do that, but if you want to dig into the weeds, this is a great resource I find. Okay, so moving on now, I apologize, folks. Um, I grouped together CalWORKs, childcare, and the social services block grants because the Trump administration is attacking them all together. In January of this year, you all may be painfully aware that the federal government froze funding, didn't go to Congress to get a new law. Congress didn't take the funding back from the states. Congress didn't change the laws about what funding states get. Congress didn't change the rules for eligibility in the communities for these programs, right? The administration unilaterally froze the funding for the CalWORKs program in California, but TANF is the national name, the Child Care and Development funding, and the social services block grant programs. And the targets were 5 states. I'll let you all guess what those 5 states have in common, right? But California, unfortunately, is one of these 5 states. The federal government cites unsupported claims of fraud in these programs. And it also demanded sensitive personal data that the providers of these services just can't collect, right? So this group of 5 states sued the federal government, and the court frozen the federal action, right? So the funds are still available. Nothing has changed in CalWORKs. Nothing has changed in this part of the child care program and in the social, at least this part of the social services block grant. There have been other threats to similar types of program, but with respect to this January 26 action, the courts have blocked it. But we can't know what will ultimately happen. I believe the feds either have already or will soon appeal. Who knows what will happen either in the federal courts of appeal or in the United States Supreme Court. So my point is that in terms of the impacts for the California state budget, and hence the impacts on these critical programs, do we have to find even more revenue? And not to further discourage people, but I couldn't help but notice an article published just a couple days ago about the ways the administration keeps withholding federal funding even after it's been sued, right? So it's a very fluid situation. But for now, there's been no change. And as far as I know, the governor's budget proposal, even independently of this concern, didn't include any kind of restrictions or funding reductions for any of these programs. More specifically, for the child care part of the state budget, the governor's proposal does include a cost of living adjustment, and that would be ongoing, every year that COLA. And it's for the DSS administered child care programs. And then there's a one-time grant for child care infrastructure, mainly for the communities in LA recently impacted by the fires. But on the downside, the governor committed in 2021 to funding an additional 44,000 child care slots. And every budget since then, people have been waiting to see them, and they haven't shown up. And they're not in this budget either. So that's a disappointment. Um, okay, moving on to WIC. Excuse me again. I know that there's been, and rightly so, toward the end of last year, when we were all, involved with the federal budget shutdown, the whole enchilada, was being shut down and debated, right? There were major questions about what would happen with WIC. Would it be funded at all? And if it was funded, would the funding include fresh fruits and vegetables, right? There was that controversy and many different proposals. And the good news is that on November 12th of last year, the Congress did pass a bill and Trump signed it, that fully funds the WIC program, including for fruits and vegetables. And so I've just given you a couple of citations there in case you want to reassure yourselves, again, because that was a pretty brutal period to go through. And I know sometimes those, bad news messages can stick in your head and you wonder what the heck ever happened to that, right? So you've got those citations. Um, just for the wonks amongst you or people who kind of want to check the numbers, I've got some resources here. And I think uh, that's the end of my slides. But I know your meeting goes on, Laurel, right till noon. And I'm very much available to be with you and engage in a conversation if people don't have questions.
Yes, everyone, like Lucy said, if you have more questions, please put them in the chat. Um,
And I think I'll just leave the slides up for a moment more to see if any of the questions address them so I can, go back and clarify if need be.
Thank you. And yes, everyone, we will definitely be sending out Lucy's slides after this, so you have all the links and resources that she's shared.
I'll give folks another moment or two to collect their thoughts and see if they have any questions or comments. But if they don't, I have some things that I'd want to ask of the group. But let's give folks some time to think about what they might want to contribute to the conversation or ask about.
Marlene, I see your question in the Q&A about the slides, and yes, we will send them to you as a PowerPoint so you can easily access them.
Well, Laurel, I would say if anyone changes their mind and has a question, they should, of course, put it in the chat or raise their hand. But I think I'll stop sharing now. We can go back to those slides if we need to. Um, I'm not sure, Laurel, Anna, and others, how you'd like to proceed with the meeting. So please cut me off if you prefer. Otherwise, I would ask the group. What are you seeing out there? Like, what questions do families have? Or just from the perspective of the work that you're doing and the services you're providing, what are your top concerns?
So in the Q&A, an anonymous attendee said, we're still processing all of this. Us too, we're in the same boat, and the negative impact that it's going to have on the children, youth, and families that we serve. Yes, we're all right there with you.
Yeah, may I, Laurel, ask a follow-up question to that excellent comment? So, one of the arguments that the Republicans in Congress made about being so mean to adults 19 to 64, both in terms of health and nutrition programs. One of the arguments they made was, well, it's not going to hurt pregnant women. It's not going to hurt little children. It's not going to hurt people with disabilities. How would you all who are doing home visits, how are you all who are dealing with families with young children? How would you all respond to that? Like, who is the family you're helping? I'd love to hear people's thoughts about that. I think it's really, powerful in the policy discussions to elevate what a family is. Like, what is the family structure? Who's in it? If you're parenting a young child, what resources do you need? How do you all go about thinking, what resources do I provide to this child? Do I just get benefits for this child, or does it matter who the village is around that little person? I'd love to hear from folks about that.
We did have one comment come through the chat, and I will say, folks, if you want to speak, just please raise your hand and we can push the button to allow you to speak if you want to actually talk here. In the chat, someone said there is fear in the South Asian communities who are heavily depending on these programs. Definitely. Yeah, again, if anybody else wants to come off mute and speak, just raise your hand and we'll unmute you. Okay, Laura, you should be able to. There you go.
Yeah. Yeah. So I work in LA County Child Welfare, and we have a lot of older adults caregiving, right? Being the caregiver for a child that was removed, and they need to be healthy to take care of the kids in their care. So, and that requires food and medical care, healthy food and medical care. So
Yeah,
it's going to have a huge impact. I think there's an investment in this administration to keep older adults sick and dependent on drugs and medications and not really keep them healthy. Um, so yeah, that would be a concern for us. I think about 60%, maybe up to 70% of all our kids in in foster care are with relative care. And they're older relatives, typically grandparents, things like that.
yeah. Laura, may I ask you, um, what's the age range when you say older adult caregivers? Do you have an idea, or can you share like an approximate age range?
Well, a lot of those kids are raised by grandparents. We're talking about 40 plus, right?
40 plus. Okay, so
Yeah.
they're right in there with the 19 to 64. You're not talking about people in their 70s. There may be some, right?
Yeah, very
But
few.
you're
Yeah.
talking about people in that
And
19
aunts
to
and
64.
uncles, right? If it's an aunt and
Yeah.
uncle or an older sibling, which
Yeah.
often happens, that's the age group, right? So,
Yeah, yeah. Well, and I'm sure, Laura, that the county will be very
yeah,
sophisticated and vigilant about the exceptions,
yeah.
right? Remember, both for Medi-Cal and CalFresh, we emphasize that there are exceptions for caregivers. They're a little
Okay,
different for each group. And
okay,
you'll have the slides so you can see, who goes to 18, who goes to 14, yada,
right.
yada. And if you're caregiving for a child who is disabled, there's no age limit. If you're
Okay,
caregiving for an adult who's disabled, so all those nitty-gritty things you've got in the slides, but I'm sure county, child welfare will be very vigilant about that.
yeah,
But it will be hard for families. And the aunts and uncles will be, I'm so glad you brought up that point because there are many families where the village includes not just the grandparents, but the older siblings in a family or aunts and uncles. And we really need to target that. I think the message coming from organizations like, LA Best Babies, making the point that it matters to keep these adults 19 to 64 healthy and having access to nutritious food, that matters for our best babies. Like we can't, do our job promoting best babies unless we have the village that the family depends on. The more you all can consider elevating that, I think it will help us certainly at the state level. This federal administration, I mean, you never give up. You have to always advocate, wherever we have the opportunity. But in the short run, I think our best bet is with the state government in this current budget debate. Thank you so much for raising that, Laura.
Had a few more comments come through the chat. Lori from Casa LA shared that her program works with children and youth in foster care until age 21. And this will be especially detrimental to youth in foster care ages 18 to 21 who might be living on their own or in transitional housing. That's another population that's going to be really, really heavily impacted by these. Zelma shared that some of the families that she serves are very young and some are returning back to school and depend on these programs. And we also had Danica who shared that very much along the lines of what we were just saying, limiting eligibility for certain members of the family impacts the overall well-being of the family. And I feel like people that work at home visiting know this better than anyone else. Even if children are eligible, many parents are afraid to apply due to the current political environment. So that's having a chilling effect even on people who would be eligible for these programs, kids that really do qualify and depend on these programs. I think also in the Q&A, uh, there was an anonymous question that said, are there ideas on how to generate more revenue in California to address these funding cuts?
Yeah. Before I try to answer that excellent question, I did want to just highlight for the foster youth, it is true that for CalFresh, there are new problems there for the former foster youth. So that, 18 to 21 year old group. On Medi-Cal, they may be exempt. So I need to get back to you all and, on the NMDs. So please put a pin on the foster youth issue. I really apologize for not being better prepared on that very important issue. Because if we can get them exempt in one category, then there may be that, overlap. But you all are raising really critical questions. If you have clients in any of these categories, it will be really important to check and double check and triple check on the exemptions. Um, and similar comment about younger parents returning to school. There is an exemption both, from the work requirements for CalFresh and the Medi-Cal work requirements for students. And so for those young parents returning to school, that's going to be a really important, make sure that we're aware of the exemptions for all those groups. I know it's a lot of information to take in. And as we get closer to these deadlines, I imagine, resources will appear with like cheat sheets about, because the state is still developing the rules. But do keep in mind that especially, for families with children, there are a lot of exemptions, and also for people with any kind of impairment or mental or physical disability or substance use disorder. On the question about revenues, it's like the key question, right? And the dilemma we face is the feds aren't coming to the rescue anytime soon. Now, I will say, and this is important, this is really important. It's important because it's a measure of how effective communities have been in pushing back against HR 1. Even though HR 1 happened and that federal budget passed, there was like another budget fight earlier this year. Trump wanted even more cuts. He wanted to add on to the HR 1 cuts. And this time, the Republican Congress did not go along. That would not have happened if people all over the United States hadn't been explaining the kinds of things that you all have been discussing. The impacts on real working people, the impacts on real parents with children, the impacts on real grandparents and adult siblings with children, and then the fallout on the kids themselves, right? The decimation in the hospital and the healthcare systems. If people hadn't been elevating those concerns coming out of HR 1, there's no question in my mind that the Republican Congress earlier this year in 2026 would have said, okay, to Trump's additional cuts. So let's keep that in mind. In terms of generating new revenue, though, it seems very unlikely that the feds are going to come to the rescue in that sense, right? In time for our California state budget. So the question there, as the participant correctly emphasizes, is what are the ideas? I can tell you this, and you've probably seen this in the media because there's been quite a lot of press attention. A coalition of healthcare providers, and I think the SEIU chapters, the healthcare labor force, have a ballot initiative and it's out for signature. I think it's still out, and I think they're still collecting signatures. This measure would impose, I think it's definitely a one-time wealth tax. It's called a wealth tax. It's not an income tax. It's a wealth tax, meaning it's imposed on a certain group that has reached a certain level of wealth, and these are billionaires. So this one-time tax would be like 5% of the wealth they already have. And if we had that one-time 5% tax on the billionaire's wealth, then it would close most of these budget holes that we've been talking about. Now, will that measure get enough signatures? Will the people pass it? Governor Newsom is opposed and is actively campaigning against it. The arguments he makes are those wealthy people, like, the guys that founded Google, the people that run Amazon. I mean, that's who this is a tax on, right? Because most of their wealth comes from capital gains, from assets. They don't pay income tax. They pay these wealth taxes. And those are the latest report I heard is at that level, those billionaires are paying like about 4%. I know I'm paying a whole lot more than 4% for my income tax, but they pay 4% because they're in a different category. So Newsom's argument is if we impose this one-time 5% wealth tax on that rarefied sector of our society, they'll all leave and California won't have the wealth anymore. And that's an argument that the governor and others are making. Other people, including some billionaires who would have to pay this 5% tax, are saying that's baloney. You can't make money the way you make money in California. It's the fourth largest economy in the world. Look at the resources we have in California. And 5% one time on my multi-billions is no skin off my nose. Take it and fix these problems and then win back the federal government. Who knows where that debate is going to end up, right? Because the governor being against it is a very powerful adversary. So that's one idea, though, the one-time billionaires tax. Another group out there is advocating to close a loophole in property taxes in California. And that would not just be a one-time fix, that would be an ongoing change in our tax code for businesses. It doesn't affect homeowners and it doesn't affect small businesses. It's a property tax on very large entities. And the example that's being given is Donald Trump actually owns a very large and prominent multi-story building in downtown San Francisco. And he pays almost no property tax on that. It's a business building, right? It's not where people live. It's a business building. And he and other property owners are not paying their fair share of taxes. That argument goes. And so there are people pushing that narrative. The problem there is that the opponents will say, well, if you touch that part of the tax code, then property homeowners who are protected under Prop 13 will be affected, right? They'll conflate the arguments, right? This is a proposal that's separate just to commercial properties, business properties, but the opposition is already saying, no, don't go there because we don't want it to then come for Prop 13. So that's one of the challenges there. And there are other examples, to the caller's question. I haven't heard yet what the legislature is thinking about doing, right? I'm sure, I hope, I pray, that they are listening to all of these ideas that are coming from the ballot initiative folks and other people running for governor. That's a lot of where these ideas are coming from. And that the legislature is thinking about what's politically viable. What can we do here in Sacramento that Newsom will sign? So stay tuned. I think we'll know, relatively soon. The budget has to, be done by June 30th, And so pretty soon I think we should be hearing from the legislature what the proposed solutions are.
Thank you so much, Lucy, for answering all those questions and for joining us this morning. I am doing a time check. We are a little over our slotted time for this webinar, but again, thank you so much for staying on and answering any additional questions and providing your feedback. I always learn so much from you, and I'm sure everyone's enjoyed it as
Likewise.
well.
Th-
Thank you,
Thanks,
everyone, for
everybody.
joining.
Thanks,
Um,
everyone.
I will include our survey link in the chat for those leaving. It should pop up for you as you leave the webinar, but just in case, if you want to click on it here before you go. But again, thank you all so much, and I hope you have a good rest of your day.